Hi, do you or a loved one suffer from acne or increased facial hair? This can be a huge problem for women, and many of them don't know how to get help. I'm Dr. Mikulics, and today we're going to talk about what you can do about these uncomfortable signs and symptoms. So the disease name for what I'm referring to is called Polycystic Ovarian Syndrome. And this is a syndrome because you don't have to have all the same effects in order to meet criteria for the diagnosis. So from a strictly medical standpoint, you do need to have two of three criteria. And that is, you have to have signs of increased androgen exposure, such as acne or facial hair, unwanted body hair. The second would be what we call oligomenorrhea, or decreased periods that are really spaced out, maybe happening, only every 3 or 4 months instead of every month or less. And then the last symptom is one that we actually, a sign is one that we see on ultrasound and refer to it as a string of pearls. And what that means is there's several little ovarian follicles that look like cysts that have never come to ovulate, and so have just kind of accumulated there on the ovaries. So traditionally, the treatment for this condition is basically a three-pronged approach. So many doctors will recommend cycle control with the help of a birth control pill, and then treating the excess hair and unwanted acne with a medicine called spironolactone. This is a 5-alpha reductase inhibitor and also has androgen blocking effects. And then lastly, some type of blood sugar support, usually through a medicine called metformin. So the bigger problem with PCOS is that it can put you at increased risk for diabetes or heart disease long term. So it's more than just an inconvenience or a physical appearance. It is something to be taken seriously. Now, if this regimen of medicine sounds a little overwhelming to you, don't worry, because there are some great lifestyle things that you can do as well. So, and I love to start with lifestyle anyways, right? Get to the core, get to the heart of it. So exercise is key and can really help keep this condition in check or reverse it altogether. 20 to 40 minutes, 5 to 6 days a week. Do it. Drinking plenty of water, another biggie. Some studies have shown yoga or acupuncture can be helpful as well. And then environment-wise, reducing the BPAs, reducing your exposure to plastics. Do not microwave in plastics. This can increase our intake of chemicals called xenoestrogens, which are basically endocrine disruptors and can just make your hormonal situation worse. From a diet standpoint, you want to do everything to increase fiber, and that can be done nicely through eating, you guessed it, the rainbow, lots of fruits and veggies, plants, and low glycemic foods as well. So sugar, not your friend. Also dairy, not a good idea. Even organic dairy has hormones in it because it's designed to feed baby cows. And these hormones can further disrupt the imbalances that you're having. So no dairy while you're trying to get a handle on any PCOS symptoms. And then from a supplement perspective, using things like chromium, zinc, cinnamon, and chlorogenic acid can all help naturally regulate your blood sugar. So I definitely would recommend giving that a try if you're, leery about going right to medications. And then before I go, I do have to put a shout out for the microbiome, which are those good bugs that live within your intestinal tract. And they are crucial to optimizing your health and wellness and reversing the signs and symptoms of PCOS. And mainly because these bugs actually make the enzymes that we need to properly metabolize and clear our hormones. So always great to support your gut health and keep living as healthy of a lifestyle as possible to address core root disease issues. I hope you found this helpful. You can always make a comment below. And until next time, thank you.